Good morning, students. Today I'll be discussing about the antitubercular agents. So that is coming under the medicinal chemistry, unit 3. So first of all, we should know what is tuberculosis. So tuberculosis is a very deadly disease which is spread by the Mycobacterium tuberculi, which is causing cough and pulmonary infection, and pulmonary, not only pulmonary infection, infection to the bone and different parts of our body. That is a airborne disease spread it through the contagious infection like sputum, coughing, sneezing, and through air and air moves, air transport medium. So they causes persistent coughing and as well as fever for a long time, pulmonary choking, and there is very problem in breathing, and as well as the weight reduction, malnutrition, as well as inability for taking food intake, like this. And it is a very deadly disease, and it can cause death to people also, because it cannot be cured with some normal drugs. So antitubercular drugs means antimicrobial drugs. Tuberculosis, often called TB, that is shortly known as, is chronic bacterial infection caused by Mycobacterium tuberculosis, and it contains unusual cell wall. Generally, this bacteria having unusual cell wall. The cell wall was a high lipid content, resulting high degree of hydrophobicity and resistance to alcohol, acid, and alkalis, and some disinfectants. That means it cannot be killed through this type of normal disinfectant and sterilizers. The organism usually attacks or affect almost any tissue and lungs, and can also affect the CNS, meningitis, circulatory system, genitourinary system, bones, joints, and it is characterized by the formation of nodular bodies or tubercles, hence the name tuberculosis. It can form some nodules. It is one of the most deadly common major infection disease today. More than 2 billion people have been suffering the world's population. In case of different unhygienic area, slum area, malnutrition area, the people can be suffered mostly, but sometimes if the patient having the low immunity, they can also be suffered by this disease also. So 1,000 people have been dying daily in India by TB, because India is a third world country. So it is containing lots of problems. TB spread person to person through air. When people with TB in their lungs, throat, cough, laugh, and sneeze, sing, or even talk with the germs they cause, TB may be spread into the air. If another person breathes in these germs, there is a chance that it will become infected with the TB. Generally, it spreads in crowded areas, elderly person, AIDS patients, and severity of the disease increased further in patients with diabetes mellitus, Hodgkin lymphoma, chronic lung disease, chronic renal failure, malnutrition, immunosuppression also. Suppose if primary infections are going on, or if any person is suffering with some disease, they have a tendency to infect by the Mycobacterium tuberculosis more, because the patient having a low immunity. That's why they cannot fight with this type of bacteria. So first symptom of TB, like an unproductive cough, feeling tired all the time, weight loss, loss of appetite, nighttime sweating, fever, coughing of blood, fatigue, night sweats, constant tiredness. So a chest X-ray examination reveals changes like pleural effusions, increased volume of the pleural space in the pulmonary spaces, diffuse infiltrates in lung parenchyma, and untreated cases may show systemic secondary aminoglycosides. So infiltration of liver, kidneys, spleen, and other tissue with amyloid. So there are some proteins, and they are agglomerated and forming some nodules type of things in the pulmonary portion, that is known as the amyloidosis. So depending upon the side of infection, the disease can be categorized as follows: pulmonary tuberculosis, that is a respiratory tract infection in the respiratory tract; genitourinary tuberculosis, like the genitourinary tract; and tuberculosis meningitis, nervous system is affected. I have also seen some with the nervous infection, like the spinal type of infection also going on; and miliary tuberculosis, a widespread infection. So coming to the tuberculosis treatment, because administration of a single drug often leads to the development of bacterial population resistant to the drug. That's why it contains several drugs and multiple drugs. Effective treatment of the TB must contain multiple drugs to which the organisms are susceptible. That's why TB tuberculosis bacteria should be killed with multiple drugs. So, definition I can go: antitubercular drugs are agents which are used to treatment of tuberculosis. So, treatment history, first of all, I can go to the, in 1938, sulfonilamide was discovered and was found to possess bacteriostatic and action, although weak in nature. Later, dapsone was developed. Although dapsone was effective, it was not considered for clinical use because it demanded high doses, which in turn were associated with the toxicity. That's why this drug was obsoleted. Eventually, many potent anti-tubercular drugs were developed in like after some time. Streptomycin, PASA, paramino-salicylic acid, isoniazid, ethambutol, and rifampicin. And these drugs are going on nowadays. The discovery of the rifampicin was a major breakthrough in the treatment of tuberculosis. This is because combination of isoniazid, ethambutol, and rifampicin required comparatively less time for producing effective results than the individual drugs alone. Since the combination of these three drugs have acquired prime importance in the treatment of tuberculosis, like isoniazid, ethambutol, and rifampicin are the most important drug for the treatment of the TB, and the streptomycin and paramino-salicylic acid is also added in case of severity. So, classification: anti-tubercular drugs are classified on the basis of efficacy and safety and clinical utility. So, first-line drugs are those which exhibit high efficacy and less toxicity. All first-line anti-tuberculosis drug names have standard three-letter and single-letter abbreviation: ethambutol, that is shortly known as EMB or E; isoniazid, that is INH; pyrazinamide, that is a PZA or Z; rifampicin, that is shortly known as RMP or R; streptomycin, that is shortly known as STM or X. Now, coming to the second-line drugs, if some of patients are not treated by the first-line drugs, or if the patient has been cured with the first-line drugs, then again, if they are infected with the secondary infection or the second time, then we can go second time, second-line drugs. Second-line drugs for tuberculosis found to be more toxic but may require with certain resistance problem. There are 6 classes of second-line drugs. SLD, used for the treatment of TB. A drug may be classed as second-line instead of first-line for one of the 3 possible reasons. It may be less effective than the first-line drugs, that is paramino-salicylic acid, or it may have toxic side effects, that is cyclosin, or it may be unavailable in many developing countries. Fluoroquinolone, aminoglycoside, amikacin, kanamycin, fluoroquinolone, ciprofloxacin, levofloxacin, thioamines, and paramino-salicylic acid, polypeptides, bleomycin, envromycin, capromycin, cycloserine. So this type of drug is known as a second-line drug because sometimes there are 3 reasons, like it may also be effective than less effective than the first line drugs. If some patient is not curing with the first line drugs, then it can be given with the second line drugs, and sometimes it may have toxic side effects, and it may be unavailable in many developing countries. So these are the second line drugs which are not so much used, but sometimes it may be used. Okay. Third line, other drugs may be useful but are not in the whole list. This drug may be considered third line drugs and are listed here either because they are not very effective. Clarithromycin, because their efficacy has not been proven. Okay, linezolid and rifabutin is effective, but it is not included in the pool list because for most developing countries, it may be impractically expensive. Another classification, we can go for the standard drug and reserved drugs. Bactericidal and bacteriostatic we can classify. In case of bactericidal, where it is very important, isonicotinic acid hydrazide, that is the INH or isoniazid, rifampicin, streptomycin, and pyrazinamide. These are the most important. Here we have to use the bacteriostatic along with the drug like the ethambutol and thiacerazone. And there are some reserved drug which can be used for sometimes second line drug as bactericidal and bacteriostatic, and so classified. Capreomycin, kanamycin, fluoroquinolones, and sometimes bacteriostatic drugs are also given with this drug: ethionamide, cycloserine, and paramino-salicylic acid. So classification based on the chemical moieties, that is we will be discussing about this. Salicylic acid derivative like paramino and salicylic acid, pyridine derivatives, isoniazid or ethionamide, like this. Pyrazine derivative is a pyrazinamide. Okay, then ethylene diamino butanol derivative, that is known as ethambutol, and antibiotic like streptomycin, rifampicin, and kanamycin, that is coming under the amino glycoside. And miscellaneous category like the fluoroquinolone, ofloxacin, ciprofloxacin, macrolide, clarithromycin, and azithromycin. Okay. Now, isoniazid. So first category of the drugs that is coming under the pyridine derivative. See here pyridine ring is there, and the general brand names are used: continazine, laniazid, isonex, like this. So isonicotinic acid hydrazide, where it is containing a pyrazinamide, pyridine derivative, pyridine ring, one nitrogen constituent member, and CONH2 NH2. That's why hydrazide name is given isonicotinic acid. Okay, it was nicotinic acid, but with the hydrazide molecule, they had been derivatives. So, 4-picoline synthesis. So, with the potassium permanganate, it is derivatized into isonicotinic acid. Then again, it is treated with ethanol in presence of H2SO4. It is forming ethanol, ethanolic substituted ethionamide. Then it is again reacted with the hydrazine isoniazide. So mode of action coming to this, isoniazid is a product that is activated on the surface of M. tuberculosis by CAT-G enzyme of isonicotinic acid. That is a product that will be activated on the surface of the M. tuberculosis as a bacteria by one of the enzyme. So it will be forming isonicotinic acid, and isonicotinic acid inhibits the bacterial cell wall mycolic acid. So bacterial cell wall of the microtuberculosis will be of mycolic acid that will be inhibiting by this drug, thereby making M. tuberculosis susceptible to reactive oxygen radicals. Isoniazid may be bacteriostatic or bactericidal in action, depending on the concentration of the drug attained at the site of infection and the susceptibility of the infective organism. The drug is active against susceptible bacteria only during bacterial cell division. That's why, in case of cell division, the cell wall synthesis will be prevented. As a result, bacteria cannot develop or cannot replicate. Okay. So there are some metabolism where the drug is broken down in acetylhydrazine and diacetylhydrazine. Okay, just next. Now coming to the para-aminosalicylic acid, that is known as the PAS. So para-aminosalicylic acid, it is known as the, at the salicylic acid contains a para group. In the para position, there is amino group. That's what is known as a 1, 2, 3, 4 amino 2 hydroxy benzoic acid. Very easy structure. So mode of action, it is amino salicylic is an inhibitor of the bacterial folate metabolism in the manner similar to the sulfonamide antibiotics. That means in case of synthesis of the folic acid, it will be inhibited. So from para-nitrophenol, it is synthesized. Para-nitrophenol is reacted with carbon dioxide, control pressure, and ammonium carbonate. So it is reduced to para-aminosalicylic acid, and the reduction produces para-aminosalicylic acid. From antranilic acid, it can be synthesized. Antranilic acid COOH-NH2, and it is reacted with the nitration. As a result, nitrogen will be produced, and with the sodium nitrate and HCl is forming aminosalicylic acid, and XnCl2 reduction will be there. As a result, aminosalicylic acid will be formed. It is very easy reaction. Next, coming to the another antitubercular drugs, the ethionamide, ethambutol. See the structure of the ethambutol. That is the 2,2-ethylene. That's why 2,2-ethylene, 2,2-ethylene, diamine, 2-amine is present, 2-butyl oil. See, at the butyl group is present, 4 carbon. That's a butyl oil. Pyrazinamide. Okay. And rifampicin, one of the very broad category. Antibacterial, that is one of the aminoglycoside. That's why it is very complex structure. Unlike second line category like rifabutin, cycloserine, and streptomycin, these are the category of the drug. Streptomycin, you have already studied about this, about the aminoglycoside antibiotic. Cycloserine, sometimes injectables are also used. Okay. Capromycin sulfate, which is not also required. Next. So thank you. Up to this, you have to study. So among this, you should study the drugs and their structure, or some of the drug synthesis and their classification, and what is the mode of action, and first line drugs, second line drugs, and third line drugs. You have to study. Some of the short question may be coming on from the treatment history and for the tuberculosis symptoms. These are the very general questions you can get in exam. So thank you very much. Thank you everyone.